The fluorescent lights hummed their mechanical prayer above the overnight corridors of St. Michael's Hospital in Colorado Springs. 2:47 in the morning. The building breathed like a sleeping animal, its rhythm steady and medicated, and Sarah Chen moved through it with a kind of invisibility that only came from being underestimated consistently and completely. Her sneakers made no sound on the cold linoleum. She had trained herself years ago, in a desert where sound meant death, to move through spaces as if she were already a ghost. Most people wouldn't have noticed her. Most people never did. The charge nurse's station glowed with the soft blue light of computer monitors. Sarah pulled up the patient roster for the evening, her fingers moving across the keyboard with mechanical precision. 43 beds. 72% occupancy. The numbers were good. The patterns underneath them were not. She had been reviewing charts for 3 weeks now, ever since the email came through encrypted channels with a single attachment, a spreadsheet of mortality data flagged by Pentagon auditors. Unusual patterns in Ranger patients. No specifics. Just enough information to know that something was wrong and that she was the only person in Colorado Springs who could see it. Her eyes traced the billing codes on the screen in front of her. Dr. Marcus Mercer. Attending physician. Emergency medicine. The man had credentials stacked like bricks: Johns Hopkins, 3 years at Mayo Clinic, published research on trauma protocols. His file read like a resume designed to make you trust him. Sarah had learned a long time ago that credentials were just expensive masks. The thing underneath could be anything. The morphine dosages on his veteran patients ran consistent and high. That alone wasn't suspicious. Combat veterans carried pain in ways that civilians couldn't understand, couldn't see, couldn't quantify on any standard pain scale. But the discharge timelines were accelerated. The follow-up care was sparse. The documentation was meticulous in a way that seemed designed to be reviewed, to be impressive, to convince an auditor that everything was by the book. Everything was always by the book for people like Mercer. She was still reviewing the charts when Dr. Mercer arrived for morning rounds at 6:15 a.m. He moved through the corridor like a man who had never been told no, his white coat pristine as fresh paper, his tie a shade of blue that probably cost more than Sarah's monthly rent. He had the kind of face that camera crews liked, symmetrical, confident, the face of a man who had spent his entire life knowing exactly what he was worth and assuming everyone else could see it too. The rounds began in room 301. A 68-year-old former Marine with pneumonia. Standard case. Straightforward. Mercer reviewed the chart with the rapid efficiency of someone reading a document he had already decided about before opening it. His residents trailed behind him like pilot fish following a shark, noting everything he said, recording his every gesture as if it were gospel. Sarah stood at the far edge of the room, arms loose at her sides, her eyes on the patient's oxygen saturation numbers. 89%. Not great. Not crisis yet. But trending down. The antibiotics are appropriate, Mercer said without looking up from the chart. Continue as prescribed. We'll reassess in 12 hours. Nobody asked Sarah if she had any concerns. Nobody looked at her. This was the way of hospitals, of hierarchies, of systems built on who had the diploma on the wall and who was just the person who emptied the bedpans when the diploma holders went home. She said nothing. The protocol was silence. The strategy was patience. By the time rounds reached room 347, it was 6:58 a.m. The bed had been occupied for less than 4 hours. The patient had arrived by ambulance at 2:15 in the morning, found collapsed near the homeless encampment on Nevada Avenue, brought in by first responders who had searched his pockets and found nothing. No wallet. No identification. No next of kin listed on any form. Just a man unconscious on clean white sheets, his clothes torn and his breathing labored, his body covered in the kind of scars that told a story nobody was asking to hear. Sarah had been there when they brought him in. She had helped transfer him from the stretcher to the bed with the practiced efficiency that came from having done it 1,000 times before. And it was in that moment, while cutting away the torn fabric of his jacket to access his chest for the cardiac monitor leads, that her fingers caught on something unexpected. Something deliberately hidden. The object was small, roughly square, sewn into the jacket lining with careful, precise stitches, the kind of stitching that had been done by someone who knew how to hide things, who understood that sometimes the smallest items carried the weight of an entire identity. Sarah's hand stilled. Her breath caught for exactly 2 heartbeats before she controlled it again. The patch was faded from years of carrying, its colors, red, white, and blue, barely visible under the patina of dust and time. A 75th Ranger Regiment unit patch. Sewn into the lining. Hidden there like a secret kept from the world. She had not moved. She had not made a sound. She had simply continued cutting the jacket away, her movements exactly as they would have been if she had found nothing at all. One of the orderlies had asked if the patient needed anything, and she had said no. Her voice had been steady, professional, completely empty of the recognition that was burning through her like a controlled fire. The jacket had been folded carefully and placed on the chair by the window. Nobody paid attention to folded clothing. Nobody searched pockets for military identification in a world where homeless men were homeless men and nothing more. But Sarah had searched the pockets. And she had found the military ID in an inner pocket, tucked behind the remains of a wallet that contained no money, no credit cards, just a single worn photograph. The identification read Specialist James Torres, U.S. Army, 75th Ranger Regiment. Date of service listed as active. Her hands holding that card had felt very distant from her body. The name meant something. The name meant everything. The name meant that the past she had buried in Ramadi had just walked into her hospital on a stretcher and was now lying unconscious in a bed under the care of a doctor who was reviewing his chart with the same rapid indifference he showed to every other piece of paperwork. She had kept the military ID. Not the photograph. Just the card. Just enough to know that what was in room 347 was not a John Doe at all. Now, standing at the periphery while Mercer delivered his assessment to the residents, Sarah watched the man in the bed with the kind of attention that looked like routine nursing observation. His vital signs were stable but not improving. His temperature held at 99.4 degrees Fahrenheit. His oxygen saturation was at 91% on 4 liters of nasal cannula. His blood pressure was holding at 114/71. Baseline. Acceptable. The kind of readings that allowed a physician to do nothing and call it medicine. John Doe, Mercer said, not bothering to look at the patient's face. Altered mental status on arrival. Possible alcoholism based on presentation. Continue supportive care. Discharge when stable. He turned to one of the residents. Order a chest X-ray to rule out aspiration pneumonia, and if his mental status doesn't improve within 24 hours, we'll arrange a bed at County General for psychiatric evaluation. He said it the way someone might say to order coffee. Efficient. Practiced. The kind of dismissal that happened in hospitals every single day to people who had no one to advocate for them, no family to call, no connections to make noise. Sarah's jaw tightened. Just slightly. Just enough that she felt the muscles pull along the angle of her face. Her hands, hanging at her sides, curled into fists and then released. The pulse in her wrist remained steady. 60 beats per minute. The nervous system of someone who had spent a decade training her body not to react to crisis. Continue as prescribed, she said quietly, her voice carrying the precise deference that had become her uniform. I'll monitor his vitals closely. Mercer nodded without looking at her. Rounds continued down the corridor. The residents trailed behind him, and the moment they turned the corner, the space around room 347 seemed to exhale. Sarah waited exactly 90 seconds before stepping inside and closing the door softly behind her. The man in the bed was still unconscious. His breathing was shallow but consistent. The cardiac monitor traced its rhythm across the screen, a steady, normal line that revealed nothing of the identity buried underneath the unconsciousness. Sarah pulled out the military ID from her pocket. She had memorized the details already. Specialist James Torres. 28 years old. Hometown listed as San Antonio, Texas. 2 tours in Afghanistan. 3 years in the 75th Ranger Regiment. And across from his photograph, printed in small letters, a notation that meant he should have received a call within 72 hours of hospitalization. A notification system. A protocol. Something that should have triggered the moment he arrived at the emergency department. But nobody had called. Nobody had checked. Because a homeless man with no identification was just a homeless man, and systems only worked when they were activated by people who paid attention. Sarah folded the card and returned it to her pocket. She placed her hand on Torres's arm, not as a nurse, but as someone recognizing a piece of her own history lying in front of her. The scar tissue on her own forearms caught the light, pale white lines running from her wrist toward her elbow. Shrapnel wounds from Ramadi. The moment when she had shielded a lower-ranking medic from an IED blast. The moment that had earned her a medal and then removed her from the field. The moment she had spent the last 3 months trying to forget. She withdrew her hand. What happened next didn't just change the trajectory of the night shift. It ended careers. But she didn't know that yet. All she knew was that the past had walked into her hospital, and now she had to decide what she was willing to do about it. The fluorescent lights continued their mechanical humming. The monitors continued their beeping. The corridors continued their breathing. And somewhere in the layers of billing codes and morphine dosages and carefully meticulous documentation, a truth was waiting to be discovered by someone patient enough, trained enough, and angry enough to look for it. Sarah Chen had all 3 of those things in abundance. She just needed time. The morning shift started with grand rounds at 0600, and Sarah stood at the back of the physician cluster with her tablet, watching Dr. Mercer navigate the 4th floor like he owned it. 3 veteran patient charts were open on her screen, all of them flagged with identical patterns. She'd spent her night shift documenting everything: morphine dosages that made no medical sense, discharge orders signed within 48 hours despite concerning symptoms, billing codes that multiplied like rabbits. The patterns were so clean they looked almost artful, if artistry wasn't another word for fraud. Mercer reviewed his cases with the casual authority of someone who'd never been questioned, gesturing toward beds, dropping names like he was selecting appetizers. When he reached the 3rd chart, he paused and looked directly at the assembled residents and nurses. Any questions? His eyes weren't really asking. They were daring. Sarah stepped forward, her voice level and precise. Doctor, regarding the veteran patients, the morphine dosages seem. Mercer cut her off mid-sentence, his smile sharpening into something that looked less like warmth and more like a blade-catching light. Nurse Chen here demonstrates why curiosity without competence is dangerous. His voice carried across the hallway like he'd just discovered something fascinating and wanted everyone to witness it. Tell me, Nurse Chen, did you attend medical school? No? Then perhaps you should focus on emptying bedpans rather than questioning protocols designed by actual physicians. The residents laughed, that particular nervous laugh that happens when someone higher in the hierarchy makes cruelty look like wit. One resident mouthed the word bedpan to another, his face twisted in mockery. Mercer continued without pause, his momentum building like a man who'd said this exact speech before and knew exactly which notes landed hardest. We have a term for this, the Dunning-Kruger effect. Nurse Chen represents it perfectly, too inexperienced to recognize her own inexperience. Sarah listened with a cold, flat stare, her jaw tight. She said nothing. Her hands didn't shake. Her face didn't flush. She simply stood there, absorbing the attack with the kind of stillness that comes from having endured worse, from having learned long ago that giving someone the satisfaction of your reaction is handing them a weapon. Mercer watched her composure with visible frustration. He'd expected something different, something he could use. Instead he got silence. He turned away, moving to the next case, and Sarah made a mental note of the exact timestamp, 0604. She'd learned to document everything. That evening, Sarah stood at the vending machine on the 3rd floor, selecting a coffee. The fluorescent lights hummed their endless, mechanical prayer. She was aware of 2 residents 10 feet away, the same ones from grand rounds, their voices carrying with the thoughtless volume of men who believed they were untouchable. One pitched his voice into a mocking falsetto, meant to mirror her diction. "Perhaps you focus on bedpan, doctor." The other laughed, a sound like a hyena discovering something already wounded. "Did you see her face?" Like a confused puppy. Mercer stood nearby, arms crossed, watching with the expression of a man approving a performance. His presence there, at this specific time, at this specific machine, was no accident. This was orchestrated. This was a teaching moment to his residents about what happened to nurses who asked questions. Sarah's hand tightened on the coffee cup, the cardboard compressing slightly under her grip. The plastic lid crinkled. Her face remained expressionless. She didn't turn. She didn't acknowledge them. She simply retrieved her coffee and walked back toward the nurse's station, her movements precise and unhurried, the way someone walks when they know they're being watched and have decided not to perform grief. The nurse's station at midnight was quiet except for the soft beeping of monitors scattered through the walls like a distributed heartbeat. Mercer was waiting there, standing with his back against the counter, a security guard positioned just behind his left shoulder. The guard's name was Rodriguez. She'd seen him before, a man built like he'd once been something dangerous and had spent 20 years transitioning into a pension. Mercer's voice came out soft and reasonable, which somehow made it worse than if he'd shouted. "Nurse Chen, there's a pattern emerging. Overstepping boundaries. Questioning physician judgment. Making other staff uncomfortable with your inappropriate curiosity." He paused, letting the word settle. "If this continues, Mr. Rodriguez here may need to escort you off premises. Permanently. Do we understand each other?" Sarah met his eyes with that same flat stare, the one she'd learned in Ramadi when Taliban fighters were trying to read whether you were afraid, trying to find the moment your nerve would crack. She'd mastered the expression of someone who had nothing left to lose and therefore nothing to fear. The silence stretched between them like a physical thing, 5 seconds, 10 seconds, the kind of silence that fills a room so completely you can hear the ventilation system working. Then Sarah spoke, her voice pitched low and steady, like someone delivering information at a briefing. "The interesting thing about patterns, doctor, is that eventually someone notices yours too." She turned on her heel and walked toward room 347, leaving Mercer with a flicker of uncertainty he quickly masked, covering it with a harsh laugh that fooled no one, least of all himself. Rodriguez shifted his weight, uncomfortable, but Mercer waved him away with the dismissiveness of someone suddenly reconsidering his advantage. Sarah found Torres unconscious in room 347, his vitals concerning but still holding the line between stable and deteriorating. His chart sat open on the computer, and she read Mercer's discharge orders with the cold clarity of someone recognizing a signature they've learned to forge: probable dehydration, resolved. The handwriting was crisp, the diagnosis efficient, the kind of documentation that left no room for argument because it left no room for thought. Mercer had already decided this man's fate before he'd examined him. She checked Torres's oxygen saturation, 89% and dropping. His respiratory rate was climbing, 18, 19, 20 breaths per minute, like his body was trying to compensate for something his conscious mind couldn't acknowledge. The subtle jugular vein distension was there if you knew what to look for, and Sarah had learned to look for it in field hospitals where delayed pulmonary embolism had killed Rangers days after firefights. The clot didn't announce itself with explosions. It waited. It let you think you'd survived. Then it moved, and everything changed. She paged the resident on call, a young man named Hawkins who she'd heard bragging about his board score. His voice came back over the phone before the second beep finished. Dr. Mercer already evaluated him. Follow the discharge plan. Not interested, not curious, just following the chain of command like it was a leash. Sarah hung up and returned to Torres, examining his chest more carefully, noting the asymmetric movement, the way his left side was working harder than the right, the subtle physics of a body betraying itself. She ordered a D-dimer test using standing protocols for patients presenting with his vital signs, forging Mercer's signature on the electronic order, a skill she'd perfected over 3 months. The lab results came back 90 minutes later, and the numbers looked like they'd been written in red ink: 4,000. Critical. Elevated beyond anything that could be explained by dehydration or simple illness. She paged Mercer directly at 0130, her heart steady as a sniper holding their breath. He arrived 15 minutes later, irritated, his face already arranged in expressions of dismissal. He reviewed her notes with visible annoyance, his eye scanning without actually reading. "You ordered labs without authorization?" "This is exactly the overstepping we discussed." His voice moved like a prosecutor presenting evidence of guilt. Sarah kept her voice level, the way you'd speak to someone explaining a dangerous animal they were about to approach. "His D-dimer is 4000. He needs a CT angiogram now." The numbers hung in the air between them like a physical challenge. Mercer glanced at Torres, then at his watch, and Sarah watched him make the calculation: the patient, the hour, the inconvenience, measured against something she couldn't see but could feel, his profit margin, his schedule, his confidence that no one would question him. "It's 0200. We'll evaluate in the morning. Your shift ends in an hour. I suggest you limit yourself to nursing duties until then." He turned and walked away, his footsteps fading down the hallway with the finality of a door closing. Sarah stood at Torres's bedside, watching his oxygen saturation drop to 87, then 85, the numbers declining like a countdown. She checked the hallway, empty, just the soft hum of fluorescent lights and the distant sound of a helicopter approaching from Peterson Space Command. She pulled her phone and photographed his chart, the lab results, Mercer's discharge orders. Her hand trembled slightly as she held the phone, the first physical crack in her composure, the only place her body was willing to acknowledge what she already knew. A pulmonary embolism didn't care about shift changes. It didn't care about hierarchy. And it was about to move. At 0200, Torres's monitor alarm screamed. Not a warning chirp but a full-throated wail that cut through the darkness like an air raid siren. The screen flattened to a straight line. Asystole. Flat line. But that wasn't the worst part. The monitor above Torres's bed showed what Mercer had refused to see all evening. Sarah stood at the entrance to room 347, reviewing the discharge paperwork already signed for 0600. Mercer had processed him like a car leaving a service bay. Intake, billing code 99285, arterial blood gas normal range, discharge to street. But the D-dimer was elevated. Markedly. The kind of number that whispers danger in a language only certain people could hear. She'd seen this before. Sanjin Valley, 2009. A ranger with a swollen calf, a medic who missed the signs of DVT, a clot that migrated north during a patrol. They'd lost him 3 kilometers from forward operating base Shank. Sarah had carried his body for 2 hours afterward, her hand steady, her mind recording every decision point where different choices could have changed the outcome. Pain was data. Always had been. Torres's breathing had become shallow over the past 6 hours. His oxygen saturation had drifted from 96 to 94 to 91. Not alarming to someone glancing at monitors. Catastrophic to someone who understood the physics of blood flow and lung perfusion. A clot loosening. Migrating. Settling in the pulmonary artery like a dam forming behind his ribs. At 0147, she checked on him again. His eyes moved beneath closed lids, REM sleep or distress, she couldn't tell. His left leg had a slight circumference difference compared to the right. Swelling. Warmth. The calf that had warned her. She documented the findings in the chart that Mercer would never read, using clinical language that sounded like routine observation rather than emergency prediction. The night shift in intensive care moved like a slow-motion film at this hour. 2 nursing assistants at the station playing phone games with the volume low. 1 resident sleeping in the call room. The attending, Dr. Kimura, covering for units and currently managing a septic patient on the surgical floor. The ventilators wheezed their mechanical rhythm. The monitors beeped their steady confirmation that people were still alive, still tethered to the institutions that claimed to save them. Sarah had been doing this work for 3 months, the real work, the classified work, and every shift had felt like operating behind enemy lines, except the enemy wore white coats and insurance credentials. Mercer had processed 247 veteran patients in 18 months. 43 had died under his care. The Pentagon auditors had flagged the mortality rate as statistically impossible, a curve that climbed too high, too fast, too intentional. Phantom billing. Ghost procedures. Discharged patients with no follow-up, no imaging, no second opinions. Just bodies cycling through the system with maximum reimbursement extracted at each checkpoint. Torres was patient number 244 in that cycle. Except Torres was also Specialist James Torres, 3rd Platoon, Bravo Company, 75th Ranger Regiment, the medic who'd carried Sarah's rucksack for the last 2 kilometers after her ambush in Ramadi when she couldn't manage it herself. The one person in that whole theater who'd seen her broken and had never treated her as anything other than a soldier. At 0159, his oxygen saturation dropped to 87. The alarm on the monitor sounded once. He shifted in sleep, his breathing becoming faster, more desperate. Sarah was already moving toward his room when she saw it, the moment his eyes snapped open, his hand clawing at his chest. The pressure. The sensation of drowning while breathing. She hit the code button without speaking. Her hands were already on his chest, checking for subcutaneous emphysema, for the crackling sensation that meant air had escaped from damaged lung tissue. Nothing. But his pulse was thundering, 156, then 168. His blood pressure climbing as his body screamed the truth his consciousness was just beginning to understand. Something fundamental was wrong. The code team arrived in 93 seconds. She counted because timing mattered. 2 residents whose names she'd learned and immediately forgot because they were the kind of doctors who didn't remember the names of nurses. A respiratory therapist who moved like he was made of actual competence. The night attending, Dr. Kimura, a man who looked at data and made decisions based on evidence rather than ego. They ran the algorithm. 2 minutes of compressions. Epinephrine 4 push. Intubation, the breathing tube slid past Torres's vocal cords and locked in place, the bear hugger warming blanket already deployed. More compressions. O2 at maximum. The defibrillator pad showed flatline still, asystole, the kind of death that doesn't respond well to electricity. At 4 minutes, the monitor showed nothing. At 5 minutes, Kimura was leaning against the wall, his eyes tired. At 6 minutes, he looked at his watch. Time of death, 2:07. Sarah didn't stop compressions. 60 compressions per minute. The rhythm of a heart that wouldn't start. The rhythm of a body refusing to become a memory. One of the residents placed a hand on her shoulder. Captain, we need to call it. Captain. She'd been called nurse by Mercer for 3 months. She'd been called incompetent. Called curious. Called the kind of woman who didn't understand her place in the hierarchy of a hospital where doctors were gods and nurses were infrastructure. But the residents knew. The respiratory therapist knew. Something in her posture during compressions had revealed what her scrubs tried to hide. It's a massive PE, she said, and her voice had changed. The deferential tone was gone. This was the voice of someone who'd made decisions that meant the difference between bodies coming home and bodies staying overseas. Pulmonary embolism. Blood clot in the main artery. We need to extract it. Kimura straightened. His eyes met hers for the first time all night. Really met hers, as if he was seeing something previously obscured. That requires a cardiothoracic surgeon. ECMO setup. This is a surgical center 3 hours away. Then he dies, Sarah said. Or we extract it manually. Anterolateral thoracotomy. We can reach the pulmonary artery through an open chest cavity. You're not suggesting. I'm telling you what needs to happen. She looked at the stunned intern, the one who'd been watching her perform compressions with something like recognition. Hold the crash cart. Get me a spreader. Anything metal, anything that can open a chest cavity. Nobody moved. The room had that quality of profound silence, the kind that comes when people realize they're standing at a choice point and don't know which direction leads to survival. Kimura was already thinking through the protocols, the liability, the impossibility of what she was asking. The residents were exchanging glances that said, "Is this woman actually suggesting we perform an unauthorized surgical procedure at 2 in the morning?" Sarah stopped compressions. Her breathing was controlled. Her hands were steady. "Doctor, he's dead. Has been for 2 minutes. I can bring him back or you can call the family." Kimura took a breath. Then he nodded. A single motion that contained everything, the recognition that she knew something, the decision that protocol mattered less than outcome, the understanding that sometimes the person in the room with the most expertise doesn't have a credential hanging on the wall. Sarah ran to the break room locker. The combination spun under her fingers, 32-18-40, and the door opened to reveal the accumulation of 3 months, spare scrubs, a photograph in a frame showing soldiers grinning at a phi base, a mug with a quotation about coffee being the only consistent thing in life. And at the bottom, wrapped in a trauma shears case, a combat knife. 7-inch blade. Titanium handle. Engraved on the side in letters so small most people wouldn't see them, Captain S. Chen. 75th RGR. Ramadi 2009. She'd never planned to use it. Never planned for the moment when her cover required more than documentation. Never planned for a patient to flatline whose name meant something to the person she used to be. Back in the room. Betadine. A swab across Torres' anterior chest, painting the sterile field with rust-colored antiseptic. The smell of it, sharp and chemical, cutting through the hospital air like a reminder of operating theaters in less stable countries. The intern was holding the chest spreader now, his face pale but focused. "When I tell you to pull," Sarah said, "you pull. Wide. Everything I need is between those ribs." The knife moved like it knew where to go. 18 years of muscle memory. Field training in Ramadi under a senior medic who'd taught her that sometimes the body was just anatomy and the body could be opened if you knew the planes between structures. Between skin and fascia. Between intercostal muscle and pleura. Blood weld. Not the controlled surgical environment of an operating room with suctioning and exposure lights. This was tactile knowledge in dim overhead light. This was feeling the chest wall separate and understanding the geometry of a human being reduced to a series of structures that could be accessed if you had the right angle and the right desperation. The spreader pulled. The intern's hands shook but held. The pericardium was visible now, that membrane that housed the heart, and beyond it, the pulmonary artery. She moved her fingers through the opening with the certainty of someone who'd done this before, who'd trained on trauma dummies and cadavers and once on a ranger in a desert whose name she'd forgotten because forgetting was the only way to continue breathing. Her fingertips found the clot by feel, that dark mass of congealed blood, the substance that had killed 1,000 soldiers throughout history, that had migrated from Torres's calf and lodged in the arterial branches like a dam breaking. Her fingers closed around it. She pulled. Torres's heart shivered once, then began to beat. The monitor showed sinus rhythm. 82 beats per minute. Organized electrical activity resuming like a radio signal finding its frequency. The residents gasped. The intern held the retractor so tightly his knuckles had turned white. Kimura stepped closer, watching as Sarah's hands moved through the closure, sutures going in with the precision of someone who'd learned medicine from gunshot wounds and blast injuries instead of textbooks. The last suture pulled tight. The bleeding controlled. The chest cavity reduced back to its anatomy of structures and planes. The betadine wiped away. Just a thoracotomy scar now, barely visible under the surgical tape, the kind of scar that would require explanation if Torres ever made it to a real hospital. The operating room silence remained. The fluorescent light above the bed hummed its constant frequency. The monitor beeped its steady confirmation, alive, alive, alive. Dr. Mercer burst through the doors 17 minutes later, summoned by one of the residents who'd panicked and called. His eyes took in the scene. The open suture tray. The blood on the floor. Sarah standing with a combat knife in a trauma shears case, her hand already clean but the evidence still fresh on her scrubs. His face drained of color. Then refilled with rage. "What have you done?" Sarah looked at him with the flatness of someone who'd already moved past this moment into the next one, the one where consequences became irrelevant compared to outcomes. My job. Within 58 minutes, the paperwork was filed. Unauthorized surgical procedure by unlicensed personnel. Theft of controlled pharmaceutical access. Reckless endangerment. Each allegation precise and meticulous, the kind of documentation that came from someone who'd learned how to weaponize procedure. By 0600, Sarah had a suspension notice effective immediately. By 0700, she was packing her locker. The combat knife went back into its case. The mug and photograph came down from the shelf. Her hands worked mechanically, the muscle memory of someone who'd broken down systems and left no trace more times than she could count. She had 3 hours before the Pentagon auditors received Mercer's incident report. 3 hours before the classified investigation into his billing practices became exposed through hospital administration channels. 3 hours before everything she'd built, the cover, the documentation, the evidence, collapsed into the moment she'd just created. The quietest person in the room might be holding it all together. Mercer's footsteps echoed through the trauma bay as Sarah finished the final suture, her hand steady as a surgical laser. He stopped at the foot of the bed, his eyes tracking the closed thorax, the crimson-stained instruments arranged with military precision on the sterile field. The moment stretched, 3 seconds of absolute silence where the only sound was the ventilator's mechanical wheeze keeping Torres breathing. Mercer's jaw tightened. He said nothing, just turned and walked out, but Sarah heard him reach for his phone in the corridor, heard the sharp clarity in his voice as he requested an immediate meeting with hospital administration. Within 40 minutes, she was sitting in an office on the 3rd floor wearing bloodstained scrubs, the red still tacky beneath her fingernails. The hospital administrator, Dr. Patricia Hoffman, sat behind a desk that cost more than Sarah's annual salary. She wore reading glasses on a beaded chain and held a document printed on hospital letterhead, Mercer's report, meticulously formatted, each allegation numbered and cross-referenced like a legal brief. Unauthorized surgical procedure by unlicensed personnel, Hoffman read, her voice clinical. Theft of controlled pharmacy access. Use of a personal weapon in a medical setting. Reckless endangerment. Each word landed like a fist. Sarah listened with her spine against the chair back, her expression carved from granite. She didn't speak. Hoffman continued, Dr. Mercer documents a pattern of boundary violations, increasingly erratic behavior, repeated questioning of his clinical decisions. The administrator set the paper down. Effective immediately, you're suspended pending investigation. Your credentials are flagged. Security will escort you from the building within the hour. The locker room smelled like antiseptic and copper, residue from her scrubs, from the procedure, from the blood she'd washed from her forearms under the sink. Sarah changed into street clothes and began filling a cardboard box she'd retrieved from the supply storage. The items were pathetic in their mundanity, a cracked ceramic mug with faded lettering reading World's Okayest Nurse, a dying succulent in a plastic pot that she'd forgotten to water for 3 weeks, a photograph in a metal frame showing her entire battalion arranged in formation outside a compound in Ramadi. 27 faces. She found Torres in the back row, grinning like he'd just won something impossible, standing where she used to stand before they'd reassigned her to this hospital 3 months ago. The photo was 7 years old. Torres was supposed to be living in civilian life by now, working construction or security, not bleeding out in room 347. The security guard waited by the locker room door, his presence both courteous and immovable. Sarah picked up the box. The weight of it was all wrong, too light, despite the fullness. She'd spent 63 days building a cover at St. Michael's, 63 days documenting Mercer's patterns, his inflated VA billing, his prescriptions that didn't match the patient's conditions. Pentagon auditors had flagged 17 Ranger deaths across Colorado Springs hospitals in 3 years, all clustered under Mercer's care with suspicious morphine billing that suggested phantom treatments, and she'd been placed here to gather evidence without breaking her identity. The thoracotomy had shattered that mission. The moment her hands had moved into combat position, the moment she'd prepped Torres's chest with betadine and retrieved her combat knife from her locker, the moment she'd opened his ribcage and extracted a clot with her fingers, Captain Sarah Chen had revealed herself to a room full of witnesses. Evening rain hammered the parking lot as Sarah reached the corner bus stop, the cardboard box growing soggy in her arms. Water streamed down her face, mixing with something she refused to acknowledge as tears, though the rain fell hard enough to explain everything. The bus appeared in the distance, yellow headlights cutting through the downpour. She could leave. Walk away from the hospital, from Mercer, from the wreckage of Project Phantom. Disappear back into civilian life the way she was supposed to once her assignment ended. The bus pulled to the curb, its doors hissing open like some mechanical predator. The driver watched her, waiting. She let it leave without boarding. The doors closed. The brake lights faded into the rain. Her phone had buzzed twice during the final walk from administration. Sarah checked the messages at the bus stop, shielding the screen with her hand. The first was from the charge nurse, a message that stopped her breath. Torres was conscious. Asking for the nurse with the scar. The words were innocent, but Sarah understood the code. Torres had been a medic before he became a ranger, and medics learned to recognize the physical marks of military service. She'd received a shrapnel wound across her left collarbone in 2016, a permanent scar shaped like a lightning bolt that disappeared beneath her scrubs. Torres had seen it once, years ago, during a medical briefing in Ramadi. He would remember. The second message was a simple instruction: come back. No signature. That message had come from an unknown number, but the voice in her head reading those two words was Major General Harrison's, and she didn't know how that was possible. She'd sent her last classified report through a dead drop 3 weeks ago. No direct contact. No phone lines. The protocol was absolute isolation until her assignment resolved or until she was extracted. But Torres wouldn't contact anyone. Torres was barely conscious. Unless someone had already reviewed the room footage. Unless the Pentagon already knew. Sarah abandoned the box at the bus stop, its contents already beginning to scatter in the wind, the mug rolling toward the gutter, the succulent spilling soil onto the concrete, the photograph sliding across wet pavement. She ran back toward St. Michael's, her civilian clothes soaked through, her pace steady and controlled despite the rain blinding her vision. The emergency room entrance loomed, and she walked through the automatic doors like she had every night for 63 days, like she still belonged here, like she wasn't about to walk into the room that would either save her mission or end her career. Room 347 was on the 4th floor. The elevator rose with the slow inevitability of a guillotine blade. Sarah's breathing remained even. Her heart rate steady. The mask was still intact, the persona of a floor nurse who'd briefly overstepped her bounds, whose curiosity had been mistaken for incompetence, whose presence could be explained by a lapse in judgment rather than military training. The doors opened. The 4th floor corridor was quiet at 2,200 hours, only the soft beeping of monitors and the whisper of ventilators marking time. Torres's room was at the end of the hall, fluorescent light spilling through the partially open door. She could see his shape beneath the blankets, an oxygen mask covering most of his face, but his eyes tracked her the moment she entered, and in that single moment of recognition, Sarah understood that everything had already changed. Torres's breathing steadied as she stepped through the doorway. The oxygen mask fogged with each exhale, and his eyes, dark, sharp, unmistakably aware, locked onto hers the moment she crossed the threshold. Not the confused stare of a man still drowning in morphine. This was recognition. This was a soldier seeing someone he thought was gone. The nurse with the scar, he whispered, his voice rough from the ventilator tube that had been down his throat just hours before. That's what I've been telling them. The nurse with the scar. Sarah's jaw tightened, but she moved toward the bed with the same measured composure she'd worn through 3 months of Mercer's condescension, through every humiliation at the vending machine, through standing at that rain-soaked bus stop with her cardboard box and shattered cover. Composure was armor. Composure was what kept her invisible. You need rest, she said quietly. Captain. Torres's hand moved, reaching but stopping short of her wrist, as if even drugged and half-dead he understood operational security. I need you to know I wasn't confused. I remember everything. I remember Ramadi. I remember you. The charge nurse, Marie, kind-eyed, meticulous, one of the few staff members who'd treated Sarah like a human being, appeared in the doorway holding a chart. She'd been present when Torres woke, present when he'd asked for the nurse with the scar, present when he'd mumbled fragments that made no sense to anyone but the person they described. Now her face carried the weight of what she'd pieced together. "His chart," Marie said quietly. Her voice trembled just slightly. "He came conscious at 2340 and asked us to read this. We got it from his belongings. His military ID." She opened the chart with trembling hands, not from fear but from the recognition of something enormous passing through her small corner of the hospital. Patient Torres states the attending nurse is Captain Sarah Chen, 75th Ranger Regiment, decorated for actions in Ramadi where she. The door burst open with the force of a man who'd been rehearsing his victory speech since 0600. Dr. Mercer stood in the frame like he'd summoned himself through sheer arrogance, his expression lit with the certainty of a predator who'd finally cornered his prey. Behind him, the hospital administrator had just received board approval for Sarah's termination. The paperwork was signed. The investigation was his justification. The unauthorized thoracotomy was his proof. "Captain Chen." Mercer's voice dripped with mockery at the rank. "I've just come from the board. Your suspension becomes permanent as of." He stopped mid-sentence. Not because of Sarah. Because the air pressure in the room changed. The two-star general entered in dress uniform, and it wasn't an entrance, it was a commander taking control of a scene. His posture made Mercer's shoulders shrink. His eyes, scanning across Sarah with the precision of someone reading a tactical situation, settled on her like a salute before he'd even opened his mouth. The subordinate was being recognized. The general moved to the wall monitor where the charge nurse had begun pulling up Sarah's file. Across the screen, Captain Sarah Chen. 75th Ranger Regiment. Silver Star for actions in Ramadi. Purple Heart. Purple Heart again. Decorations that meant she'd been shot, bombed, shattered, and had continued to operate. The general saluted. Fist to chest, held for 3 seconds, released with the respect a soldier gives to another soldier who has bled for this country. "Captain Chen," the general said, and his voice carried the weight of command, of federal authority, of an institution that made hospital administrators look like middle managers. "Medcom needs your debrief on Project Phantom within the hour. We've frozen all of Dr. Mercer's billing access pending investigation. Your cover was compromised by direct action that saved Specialist Torres' life. That action is exactly why we sent you here." Mercer's face drained of color. His mouth opened and closed. Opened again. The words wouldn't come because there were no words that could undo what was happening in front of him. He wasn't standing in his hospital anymore. He was standing in someone else's jurisdiction. Someone else's authority. His power, the power he'd cultivated through connections, through strategic alliances, through knowing how to work the system, meant nothing here. "You're being investigated," the general continued, his tone conversational but absolute, "for fraudulent billing of VA services, unnecessary discharge of veteran patients, and the resulting deaths of 12 service members attributed to premature hospital discharge protocols designed to maximize reimbursement. This hospital is now a federal investigation site. You'll cooperate fully or face obstruction charges." Sarah watched Mercer's expression cycle through shock, then rage, then something that looked almost like panic. The vending machine where he'd watched residents mock her accent while he smiled approvingly, that wasn't a private moment anymore. That was evidence. That was federal. By 0800 hours, Mercer's phone was ringing continuously. Not patient calls. Not administrator check-ins. Calls from lawyers, from the state medical board, from reporters who'd gotten the story. A decorated Army Ranger captain working undercover as a night shift nurse had exposed systematic fraud that had killed veterans. The story was already online. Already spreading. The hospital's PR team was in crisis mode. Someone had leaked the footage. The vending machine video. The phone footage captured by a patient's daughter on 0517 when she'd arrived for early morning visiting hours. the daughter whose father, a Marine veteran, had been discharged by Mercer against medical advice, readmitted 3 weeks later with complications, and had eventually died. She'd recorded Mercer watching the residents mock Sarah's accent with what looked like approval. She'd uploaded it at 0623. By 0700, the video had 400,000 views. By noon, 2 million. The comments were devastating. Veterans. Active duty service members. Former patients sharing their own stories of premature discharge, of billing discrepancies, of treatment refused because they questioned Mercer's decisions. The pile-on was systematic and brutal. That afternoon, someone tagged Dr. Robert Kensington, Mercer's medical school mentor, the legendary physician whose endorsement had launched Mercer's entire career. A man whose name on a recommendation letter opened doors, kept doors open, made doors impossible to close. By midnight, Kensington had released a public statement: "I am horrified by the conduct displayed in this video. I withdraw all professional endorsement of Dr. Marcus Mercer and support the full investigation of these serious allegations. The physician I see in that video is not one I can defend." The statement spread like shrapnel. News outlets picked it up. Other colleagues Mercer had relied on suddenly became unavailable for comment. The State Medical Board's emergency review accelerated. By Wednesday morning, the board had issued a suspension notice. By Thursday, Mercer's attorney was advising him to prepare for permanent license revocation. His career wasn't ending. It was being dismantled in real time, piece by piece, with every piece publicly documented, every consequence publicly witnessed. 2 weeks later, Sarah stood at Torres's hospital window as dawn broke over Pikes Peak, the mountain rising above Colorado Springs like a promise that some things couldn't be corrupted. Torres sat up in bed now, breathing on his own, his recovery accelerating the moment his body understood it had actually survived. The thoracotomy had saved him. The diagnosis Mercer had missed, the pulmonary embolism floating in his pulmonary artery, would have killed him within hours. The military ID rested on the bedside table, the one Torres had tried to show first responders before collapsing, the one that had revealed his identity and triggered everything that followed. It was no longer classified. It was no longer a secret. It was evidence that patterns, when examined carefully enough, always expose themselves. Torres watched her watching the dawn. "What happens now?" he asked quietly. "Promotion," Sarah said. "Major. Assignment to Medcom Investigative Unit." She paused. 3 months leave first. "Because you're a hero now." "Because I was a hero before." "The investigation doesn't change that." Her voice dropped, that commanding tone settling in like she'd been practicing it her whole career. Being invisible just meant nobody else had to lie about what they saw. In the parking lot below, a man loaded cardboard boxes into a white medical supply van. Dr. Mercer. His private practice dissolved. His hospital privileges revoked. His license suspended. His retirement stretched ahead, not the leisurely golf and travel retirement he'd imagined, but years driving a delivery van, moving bedpans and gauze between clinics and pharmacies, passing the very hospital where he'd once ruled. He looked up. His eyes met Sarah's in the window. She didn't move. Didn't shift her gaze. Didn't give him the satisfaction of visible reaction. She just held his gaze with that same cold, flat stare she'd held in the nurse's station when he'd threatened her. When he'd humiliated her. When he'd thought she was nothing. Mercer looked away first. The general's discharge papers were signed within hours. Torres transferred to Walter Reed for continued recovery. Sarah walked down the corridor one final time, past the vending machine where her accent had been mocked, past the nurse's station where she'd spent 3 months invisible, past the supply room where she'd retrieved her combat knife before saving a man's life with a field thoracotomy that broke every protocol and saved everything that mattered. At the hospital entrance, a young nurse struggled with an fall line on a homeless veteran. The attending physician had ignored her pages. Without hesitation, Sarah set down her bag, took the tourniquet, and showed the nurse the technique: find the vein by feel, not sight, trust your hands completely. The needle went in cleanly. The veteran nodded. The young nurse looked at Sarah, at her posture, her movement, the way she carried authority like others carried grief. "You serve?" the veteran asked. Sarah considered it, considered the deception she'd worn for 3 months, considered the truth she was about to step back into. "Still do," she said simply. Outside, Torres waited in a military transport, grinning that same grin from the Ramadi photo where he'd stood in the back row where Sarah used to stand. As they drove away from St. Michael's, she looked back once. The empty bus stop where she'd stood in the rain with her cardboard box of possessions, the cracked mug, the dying succulent, the photograph, was already fading into her past. New nurses were heading home on the evening shift, visible, acknowledged, their names known. Sarah had spent 3 months being none of those things. The quietest person in the room might be holding it all together. Like and subscribe if you love stories about people who've been underestimated. Comment below if you've ever had someone doubt you and you proved them wrong. Let's get back to it.